Hello, my name is Diana Osantowski, and today I'm going to be doing an assessment on the 12 cranial nerves on my patient. So I will start off with cranial nerve number 1, that is the olfactory. We will not be testing that one, so we will move on to cranial nerve number 2, which is the optic nerve. I will start by testing the peripheral vision. So I'm going to have the patient cover one eye, please. Okay, please tell me when you can see my fingers.
Yep.
Other side.
Yep.
Okay, then I would have the patient move and stand about 20 feet away from the Snellen chart. I would ask the patient if he wore any contacts or glasses.
I do not.
Okay, if he did, I would have him wear them for the exam. I would start by having the patient cover the left eye so we could test the right eye. Then we would do the opposite to test the left eye, and then we would test both eyes. I would have the patient read the lowest line on the chart that he possibly could read. And in order to pass that line, he would have to get less than 3 characters incorrect. And a normal finding for this would be 20/20 vision. So after these 2 tests, I would say that his optic nerve is intact. For cranial nerve number 3, the ocular motor, I will be testing the EOM, so looking for any extraocular movements. So I will have the patient follow the tip of my pen, please. And I'm not noting any signs of nystagmus or any sort of EOMs. Okay, so for the next part, I will be testing the direct and indirect pupillary response. So I'm just going to have the patient look forward to check the direct pupillary response. Okay. All right, now I'm going to check the indirect. So I will shine the light in his left eye while I'm looking at the right eye. And vice versa. Okay. So the patient's eyes appear to be pearl, so they are equal round reactive to light, and we will test for accommodation. So please look at the tip of my pen. And he's able to accommodate, meaning his eyes go inward and downward, so he's able to accommodate. So cranial nerve number 3 is intact, and then once we move on to cranial nerve number 4, the trochlear nerve, we would use accommodation to test that cranial nerve, which as we saw, he was able to accommodate. Therefore, cranial nerve 4 is intact. Cranial nerve number 5, the trigeminal, I'm going to test his motor response by having him push away from my hands. Okay, now push resistance and resistance. So that is intact. We normally would also test the sensory, which would be taking a Q-tip or cotton ball to test the sensory of the face, the cranium, the cornea, the nares, and the mucous membranes. So cranial nerve number 5 appears to be intact. Number 6, we would be looking for lateral movements, which we already tested with the EOM. So I would have the patient follow, and he is able to move his eyes laterally. So cranial nerve number 6 is intact. Cranial nerve number 7 is the facial nerve, and we will be testing the muscles of the mastoid. So I will have you go ahead and chew for me, please. And then I will be testing his labial speech. Can you please say rainbow?
Rainbow.
He is able to repeat a 2-syllable word. And then I would also have him smile, frown, raise your eyebrows, and puff your cheeks out, please. So it appears as though cranial nerve number 7, the facial nerve, is intact. Next, I'm going to test the acoustic nerve, which is cranial nerve number 8. So I'll have you plug one ear for me, and I'm going to whisper a 2-syllable word and see if you can repeat it back.
Baseball.
Okay, other side now.
Baseball.
Okay, wonderful. Next, we will move on to cranial nerve number 9, the glossopharyngeal. I will have you go ahead and open your mouth and say ah.
Ah.
The uvula is midline. It is able to move up and down freely. I will also have you, I would use a tongue depressor and touch the back of his tongue to stimulate a gag reflex, and he has a gag reflex, so we would say that the cranial nerve number 9 is intact. Next, number 10 is the vagus nerve. I would have him repeat his name and date of birth. Can you please repeat that?
My name is Robert Osantowski, and my date of birth is August 16th, 1988.
And his voice appears to be clear without any hoarseness. And would you please swallow for me? And the patient is able to swallow effectively. Next, I would test the cranial nerve number 11, the spinal accessory. Would you please push against my resistance, and shrug your shoulders. Okay. So cranial nerve number 11 appears to be intact. And the last one, cranial nerve number 12, the hypoglossal. I'll have you stick your tongue out. Tongue appears to be midline. Can you move it to the right and the left? Beautiful. Okay, so cranial nerve number 12 is intact, and that is my cranial assessment. Thank you.